If you're sitting the UCAT, what you're about to watch is a long webinar where I go through everything that you need to know about how to score highly in the UCAT. So everything from the basics of the test, how to prepare, and what you can do to put yourself in the top 3 to 5% of test takers so that you can really take control of the application and maximize your chances of getting into either medical or dental school. There are loads of more free resources if you want to check out the channel, but otherwise I'll just let you get on with it and hope that you enjoy the webinar. So this talk obviously is how to get a 3,000 plus score in the UCAT. Now, I'm going to talk about the significance of the 3,000 number, but as you guys probably know, the UCAT is an exam that is not the be all and end all of med school applications, but is a big part of it. And I'm going to talk firstly through some misconceptions that people have and some worries that are maybe unfounded and versus just some truths and untruths about it. The essentials that you need to know, the understanding of it within the broader context of the application, the most effective techniques. We'll talk about how to prepare and score highly, where to get help. We'll speak to a student later who went through our program last year and got a 3,000 plus. I can't remember. She did really well and got into her first choice university, which is one of the most demanding UCAT wise that you. It's the most demanding for UCAT scores. So she'll tell you how she did it. And then we shouldn't be more than 2 hours, but we'll have time for questions, chatting to, like I say, one of our students, and you can really understand from someone who's done it recently what they did and get their fresh perspective. So just very quickly about me, my name is Dr. Hilton. Well, please just call me Ash. I studied and graduated from medicine back in 2013 now. And then I wanted to go into a very niche type of surgery, which is head and neck or face and mouth. So I needed to do a second degree in dentistry. So I have done this process many times. And during the time that I was at medical school, so we're talking probably about 13 years ago, while I was about halfway through, I've been helping people get into medicine ever since. And I have done it probably in the most competitive way that you can do it. And so I went to King's College, and yeah, both degrees were very, very competitive. And I won't bore you with that now. I'll show you where you can maybe find out a bit more about that. But essentially, I've been learning how to crack the code and teaching how to crack the code of getting into medical school for a long, long time now. And I've been an interview panelist and continue to interview students, read personal statements, help with UCAT preparation, all of the ingredients that go into a good recipe of a good med school application. And so I do that through my company, which is FutureDoc. And yeah, that essentially we've got an incredible success rate at helping students get in. So here are some of the lessons that, the kind of the broader concepts that I teach my students that have got us the really high success rate that we have with getting students into medical school. So, sorry, I'm kind of still going between admitting people and looking at questions and answering and trying to present. So let's do a quick poll. So what I want to do is test your understanding of the UCAT first. So this is just on a 1 to 5 scale. I'm just going to ask you 2 questions. So how clear are you on the exam format and the best techniques for how you should prepare? And the second question on a scale of 1 to 10, 1 being the highest, how worried are you about the UCAT? So if you just answer the questions now. So there are 2 questions there. So just 1 to 5, 1 being the highest, 5 being the lowest. And just tell me how you feel about, firstly, your understanding of the exam, and then how worried you are about it. Again, 1 being the highest level of worry and 5 being the lowest. Great. So I'm going to give another 20 seconds to do that. And then we shall carry on. Got about 70%, about 3/4 now, nearly everybody. Just give 5 more seconds just to submit your answers. And then I shall reveal. Okay, cool. So let's see.
So let's have a look. So for clarity on the exam, people are about in the middle. So feel about a 3 out of 5 or level 3. And then for worried about the exam, a lot of people are 1 or 2. So yeah, that seems about right for this stage of the year. Yeah, we'll talk about that in a moment. Let me see what I've got here. So what's your biggest we talked about what's your biggest concern about the UCAT, but anything particular about the UCAT at this stage that you're not clear about, that you would like to air, or just is there something in particular that you would like to know about? So I'll give you another minute or so in the chat to do that. When is the best date to take the test? Yeah, we'll talk about that. Absolutely. When should you start preparing? Yeah, important as well. Time management during the test. Any maths resources, tips and strategies for VR, how you should prepare best. Yeah, perfect. Yeah, these are good. Again, it's I'm glad that these questions are coming up because this is exactly what's in the plan. So, cool. So, finally, as a bit of a temperature check from you guys, one final poll. I want to see how important is the UCAT? So I've just given you some options here. So how important is the UCAT towards medicine and dentistry applications? Number one, most important factor, very important. Medium importance, it depends, not that important. So again, we've got, let's see. Excuse me, sorry. As I said, haven't quite fully kicked this cold yet. So 3/4 have answered. I'll give another 10 seconds for everybody to submit their answer. Okay. 5, 4, 3, 2, 1. Okay, perfect. So the consensus is generally 70 or 71% of you feel that it is very important. So only 18% have put number one most important factor, and then some have put it depends. And I think everybody agrees that it does have a level of importance because nobody has selected not that important. And the answer is really that it does depend. It is a very important part of the med school application. Now, the thing that people make the mistake of thinking is that it is the be all and end all. The UCAT, a good UCAT doesn't guarantee anything, but a bad UCAT score can close a few doors, and if not, make the application very, very difficult for you. So you can make your life easy and take control of the application. There's still work to do. This is the main thing that I'm seeing this time of year. We have kind of people getting ready for this cycle, which is they're submitting their application in September. We have people on the back end of the last cycle. Now, always this time of year, I see people come to us for help because they have made the cardinal sin of thinking that it's just about the UCAT. Because now more than ever, we're seeing people get a good UCAT score and get to interview, but then not thinking about the other elements. So there's a talk I gave last month that's on my YouTube channel, and it's about how to think about the application as a whole, because it's all about compartmentalization. I talk about 4 phases of the med school application. We're now coming to the end of phase 1, and phase 1 is all about setting the wheels in motion for good things to happen, having all of the kind of CV building type stuff, building the traits to make a good doctor, just putting all of that in place and having it on autopilot. We now, and the reason that's really important is because when you come to interview, that stuff will have accumulated. And when you have nailed that stuff, you can almost set it and forget it. Not quite that to that extent, but you can almost have that done, take your brain capacity on and move it onto something else. And then you can have all of those things accumulate in experience, in knowledge, in confidence, lots of things that when it comes to writing your personal statement, going to interview, make a kind of already done and just make you look like the real deal, the kind of candidate that would make a great doctor and they really should offer a place to. So it's all about being well prepared. And if you can organize yourself so that you're dedicated, you're concentrated in the right ways to the UCAT, then you will do well in it. You also, like I say, need to get a decent enough score to take control of the application. If you get a good score, you can almost, like I say, if you do the other elements, you can give yourself a very good chance of getting in front of the interview panel. Then you can prepare well for interviews and make sure that you convert that opportunity into an offer. So the UCAT is a very important element of it, but it is not to be, the other elements are not to be underestimated. That's the main thing that I would say. Now, the reason that the answer is, it's almost a trick question, that, Paul, because it is very important, but it also depends, because you have to think of what your UCAT goal is. For some people, the goal is to get into a specific university, and if that is Newcastle or King's or whatever high demanding UCAT score university it is, you basically need to be aiming for a 3,000. Now, the aim for everybody really is to get as high as they can, but some people have a specific score in mind, whereas some people are just like, look, I'm just going to do my best, try and get in, the top few deciles of scoring, and see where I can apply based on that. So, I see two types of people coming for help at FutureDoc, and that is either I just want to get into medicine. I don't really mind where it is that much, as long as I get a place, versus, no, I've really got my heart set on this university and I want to go here. But I am kind of getting ahead of myself here for a moment, because for some people, we're not even sure what the UCAT is yet. So let's talk about that. So it's a 2-hour exam. There are time allowances for certain people to have 25% extra, but it's a computer-based test that has 5 sections. And the thing that is very different to any exam you've probably sat before at this stage, even if you're a graduate, is that this is not a knowledge exam. Some parts are very similar to IQ tests, but it is testing your skills. And those 5 sections are all looking at different skills that they have ascertained, or the powers that be have ascertained, make a good doctor. So it's things like using logic, being able to pick things out of a text when reading, and understand the poignant elements of a passage, and being able to answer questions and distinguish between what it is saying and what it isn't saying. Using numbers quickly to be able to make drug calculations, or various calculations that you make when, as a doctor, you're treating patients. So also, there's a kind of what I would call an ethical element in the situational judgment. So I'm going to go through each section and talk you through what they are testing in each of those. But the main thing is that this is a skill. You really have to understand that it is it's a performance, and I'll talk about how to prepare for that performance later on. But like I say, the most important thing is that it's not knowledge based. Taking skills, yes, but taking an outside knowledge is not what they're looking for here. So most universities require the UCAT. Out of the 44, and it's increasing, but the 44 medical schools, only 8 don't take the UCAT. And I'm not sure if you guys are aware, but there are basically 3 exams. If you're undergraduate, there are 2 exams: the UCAT or the BMAT. Now, the BMAT is historically one that Oxford and Cambridge and UCL and Imperial require, but this is the final year. This coming autumn is the final year that they're going to have the BMAT. So they haven't quite announced yet exactly what they're going to do to replace the BMAT, those universities, but the likelihood is that they will adopt the UCAT. So it's becoming even more important, and is a test that essentially is looking like most universities will take. Now, the other exam for the graduates is the GAMSAT, and there don't seem to be any changes afoot with that, but that's an aside. So, yeah, we've established that it is important. And these are the 5 sections that I was talking about. So verbal reasoning is, as it suggests, it's picking out important pieces of information from a passage. Decision making is all about your logic. Excuse me. Quantitative reasoning is all about how you handle numbers. Abstract reasoning is the one where they're testing really to see how you recognize patterns and can think outside the box. And situational judgment is all about professional judgment, basically your ethics, and what to do in certain situations. Now, excuse me. How is the UCAT scored? So these sections and this section are very similar in the sense of how they're scored, whereas this SJT is the thing that you do at the end, and it's scored slightly differently. So the first 4 sections, like I say, quantitative reasoning, abstract reasoning, verbal reasoning, and decision making are maximum 900, and the lowest score that you can get is 300, even if you turn up and the best thing that you do is fall asleep on the keyboard and bash a few keys with your forehead, you'll still get a 12,000, so 300 for each section, each 4 sections, and a band 4 for the situational judgment. The best possible score you can get is 3,600 and a band 1. So that's what I'm saying with the situational judgment. It's just scored as a band 1 to 4, and 1 is the highest you can get. I think the best I have ever seen on my cohort is we trained someone who actually didn't do well 1 year and then came to us for help for the second time, and they scored something like a 3,280. I think that's the best I've ever seen. And then, like I say, the worst score you can get is 1,200 band 4. So the thing with some misconceptions or misunderstandings about the UCAT. So you get the score immediately. Now, I'll show you, you get ranked into deciles. So into top 10%, second 10, and all the way down to the bottom 10%, right? That you don't know. So you'll know your raw number. Like, this is how it looks. You get your score for each subtest and a total score, and then your situational judgment, as you can see at the bottom of here. You will get that score, and you can pretty much judge based on previous years. It doesn't vary that much where you will land. You maybe there's a bit of leeway by 1 decile either way, but pretty much you can tell. But that's the thing that you don't know for sure, because it depends on the other people sitting the exam. But when you get your score, you can know pretty much straight away whether it's a good score or not. You can tell just based on previous years. So you get 1 attempt per cycle, and there are no retakes. So, like I say, once all the results are in, they get placed in deciles, and I'll show you the deciles in a moment to give you an idea of kind of what average scores are. So for the last, what are we now? 5 years. Here's what, as you can see, well, the first thing that you can see is that actually the numbers of people taking it are going up. Now, we've had a peak around COVID, and then this is a strange thing. If you guys saw the talk that I gave last month, we've had a reduction in the numbers. That this last year was 36,374. However, they've reinstated the cap on places this year. So when you had 37 people, so this isn't necessarily 37,000 people applying to medicine. This is 37,000 people attempting the UCAT. Now, because you get a few people that will attempt the UCAT and use that to see whether they apply to medicine. Now, I think that is sometimes a bit of a flawed way of approaching it, unless you've done it so badly that you really don't stand a chance. But I get a lot of people who come to us after the UCAT who've got a bad score for help. And remember, I said, the UCAT is one element. It's important, but it's just one piece of the jigsaw puzzle. So people come to me after with not very good UCAT scores, and we still managed to find them a place at medical school. So all is not lost with a not great UCAT score. So, take solace in that. But anyway, as you can see, the numbers are going up of people taking the UCAT, and it does represent the people who do then go on to submit an application. The only difference is that here we had 10th in the 2021 and 2022, the places to medical school were uncapped. So we had about 10,500. Now, so we had 37,000 people, minus a few who didn't submit an application, applying for 10,500. Here, we've got a slightly reduced number, but this is for 7,500 places now. So it's going to get more competitive, and we have to really, be on our game with all of the, what I would say are 5 elements of the med school application that you just need to absolutely nail to give yourself the best chance of getting in. So that aside, historically, verbal reasoning is always the most difficult one. As you can see, the average score here is in the around the 570-ish mark. Normally, the quantitative reasoning is the highest scoring one, and the one that so these 2 sections are the ones that people start the worst and have the most improvement on. And then decision making is typically, it's quite varied really, but middle of the road sort of thing. And the average score has kind of stayed. We had another bump around COVID. We are starting to see a bit of what we call grade inflation, where people are getting better at understanding the test and scoring higher. So, but that's good because it means that we understand. Like for me, that's great because we understand the test even better, and we know how to teach people how to do really well at it. So, nothing to worry about. You just have to stay ahead of this curve of improving scores. So remember I said that your overall score gets divided into deciles. And this is what I'm trying to say here, that once they collect all the scores for the year, so everybody who sat during the window, and it's a long examination period, it's about it's between 2.5 to 3 months. So at the very end, they take everybody, they divide them into deciles, and they say, right, everybody who's got above 2,750 is in the 8th decile, everybody who's got above 2,880 is in top decile, and etc. etc. So this is how people get divided, and the universities will use the decile. Each university kind of uses the UCAT score slightly differently, but they will usually just use the deciles as a barometer of how well somebody has done. But as you can see, if we just take the 5th decile, for example, about halfway point, you can see that it doesn't really change that much. Okay, yeah, 20 point swing at one stage, or maybe a 30-point swing, I suppose, here at one stage, but it's not that much. Generally, that's what I say. When you get a score, you know roughly where you're going to land within a decile, maybe one either side, but you get a rough idea of whether you've got a good score. Just to quickly round that off, we'll look at the SJT bands. And the thing with the SJT is, obviously, you want to aim for band 1. Realistically, if you're in the top 2 bands, you're doing well. Some universities, again, and this is why picking your university based on how you've done in the UCAT and various other things is such an important part of the med school application, because some value the SJT very highly and count it as double. They give you double points for it, and others don't really worry about it so much. So these are all important factors as to where you decide to apply. But really, you need a minimum band 3. There are basically no universities that will let you in with a band 4. So that's and even with a band 3, it's going to be difficult. But with a band 4, it's definitely going to be almost impossible. So before I do a poll, I'm actually just going to, because it has kind of prompted me to share some of this stuff, because if you want some really good free resources, my YouTube channel will give you a very good start. Sorry, this cough will be with us for the entire talk, I'm afraid. Let me just post everyone in the meeting. So, if you look here, this is my YouTube channel, and there's everything that I've said. Oh, gone into a bit of detail about. There's an entire YouTube video based on that. So, it's really good for going into any of those queries that you have, or understanding your university choices, or what to do if you've got a low UCAT score. I've got kind of really any situation that you can think of. I'll give you a rough idea of what you can do to help you. So, have I got a strategy for UCAT prep? Yes, we're going to be talking about that in a moment, Vernon. But I'm actually going to show you the thumbnail to look for on the channel. There's a specific video that I talk about the how to prepare for UCAT, and give you kind of a plan based on how far out you are. Let's do a poll. So I've probably talked your ears off for a moment. So tell me, sorry, let me just get this poll up. So tell me, why do you think people score badly in the UCAT? What's the most common cause for students performing badly? So we've got difficulty of questions, poor accuracy and silly mistakes, incorrect technique, running out of time, underestimating the exam. I'm going to slurp some coffee while you guys are doing that. It's quite interesting watching the votes come in, because it's a bit like a horse race. All the little bars are overtaking each other. Okay. Right, last 10 seconds. I'm going to slurp a little bit more coffee. Last 5, anyone who's not answered. Okay, let's do it. So, interestingly, no one's gone for difficulty of questions, poor accuracy and silly mistakes. So by far, 43%. So by far the biggest answer selected, which is incorrect technique. And then running out of time is 30%. Underestimating the exam is 21%. Now, not that it's a trick question. Actually, there is a correct answer, but all of the above is true. All of the above are true, sorry, should I say? Because underestimating the exam is a big part of it. People do think that they only realize how time pressured it is when they probably have a few weeks to go. Now, that's really important to feel the pain of what it's like early on, because you then know where the bar is. What happens with some people is that they only see kind of the level that they need to be at with a couple of weeks to go, and really put themselves in a bit of a panic. The real, because basically the real reason why people don't do well in the UCAT is that they run out of time. That's the number one. Oh, actually, sorry, I've not shared the results here. So I'll show you here. So although people think incorrect technique, it is true, but the biggest cause of people not doing well in the UCAT is that they run out of time by a long way. And this is where all of the above come into it, because incorrect technique is a byproduct of going, it leads to people going slow, and then you obviously run out of time. And that can be a knock-on effect from having underestimated the exam. And incorrect technique can cause poor accuracy and silly mistakes, and then it can get you to struggle with the question level difficulty. So it's all relative, and it all feeds into one another. But running out of time is by far the number one reason people don't do well. Now, the thing that I always teach my students is people get really caught up on getting the questions 100% right. So you're going through every single question, taking too much time to ensure that it's correct. But it's actually a numbers game. You need to get through everything. Like I say, the analogy that I always give is that if you get through 70% of the exam, but you get 100% right, you'll get 70%. If you go through all of the exam, but with an 80% accuracy along the way, you get 80%. And that is kind of how you should think about it. A lot of the time people they have difficult questions in there to assess your management, your exam management. And the more amateur people will stumble on those questions, spend too much time on them and not progress. And then they won't get to the easier questions that are later on because they've spent too much time on that. And there was easy marks they could have picked up, whereas they've stumbled on spending too much time on questions that will give them the same number of marks. So, yeah, that's a really important part in game management or in exam management. And actually, on my YouTube channel, I have I think it's called UCAT What to Do on the Day, in exam tactics, what to do on the day. And that is a kind of where I go into a bit more detail about all of that. So, if you don't answer a question, can you go back to it? Yes, you can. I wouldn't. So, one thing that we always say is that if you struggle to answer a question, flag, move on, and then come back at the end. Flagging too much, it's a fine balance because you can when I say flag, you can basically mark the questions that you want to, and then at the end it will give you the option to say, do you want to go back and review all the flagged questions? And you want to get the balance right because you want to be moving through the test at a good pace so that you're delivering, you're working your way through it, but at the same time you want to not have too many flagged that you're not answering questions, and then you go back and essentially, because every time that you flag a question and move on, it's precious seconds that you're not answering questions. So the balance is right. So you've got to get the balance right. So this is where we're going to talk about technique and all of that stuff. Okay, cool. So I'll stop sharing that. Let's move on. So what's a good score? We talked about deciles. Now, getting a good score, really, again, it depends on where you're applying. We always say kind of in the top 2 or 3 deciles, you have a good chance of getting at least one interview. This is why it really does depend on what your goal is. If you have a set university in mind, they'll give you a pretty good indicator of what you need to get in terms of your UCAT score. However, my philosophy and the way I teach my students is we need to just aim to be the best we can possibly be. If you are bulletproof, if we're aiming for that, we take control of the application. It's like, I always say that when you have something that's competitive, like applying to medical school, if you're focused on just being the best you can bloody be, just the best damn applicant out there, then you don't worry so much about the competition. You're focusing on yourself, and that is when, it's that kind of Olympian mentality. They're worrying about their preparation, their game, not focusing too much on other people, and that's usually the people that do really well. Now, for me, that means I want to train every one of my students to get a 3,000 plus score. 3,000 is not even in the top decile. It's like the top, depending on the year, it's like the top 3%, 5% sometimes. And like I say, if you prepare well and you focused well on the task at hand, we've taken many students who've got 2,300, which, as you can see from these scores here, so 2,000 deciles, 2,300. So that's like in the lowest 3 deciles, and then with a bit of training, got them to 3,000. And it just shows that it is something that if you do the right kind of prep and get the right guidance, you can smash this. So, like I say, we're aiming for that 3,000, just so that we can take control of the application, put ourselves in a really good spot, and just go out there and basically get the UCAT out of our mind, sorted out of our mind, so we can then focus on the next hurdle, which is writing a fantastic personal statement, choosing medical schools that are really right for us, our individual strengths, our preferences, what are going to give us the best chances of success, and then going on and smashing the interview, which are just, like I say, the UCAT's important, but these are overlooked. And there are some other elements as well that come before the UCAT that we need to think about. But this is why people who, I think in a minute I've got, in fact, let me talk about the timeline. So here's the application timeline. And I always work backwards from medical schools starting, right? The med school application process. Let me just actually, let's, as a question to you guys, how long do you think the med school application process lasts? How long would you say you will be spending thinking about your med school application? Just in the chat. Maybe just put it in months. So 8 months, 3/4 of a year, or 3 to 4 years, I'm not sure. 1 year. Okay, so we've got anything ranging from 4 months to a year and a quarter, 24/7, not far off. So yeah, medical school, the process, I mean, some people obviously know from a young age that they want to do it, so they're always working towards it. But really, if you're serious about the med school application, you need to be putting in about 12 to 18 months of work. And my mantra is, the earlier you start, the more time you put in, the more likely your chances of success. And we work back from September. So if you can see on the right here, can you guys see my mouse, by the way? Can someone just put a yes if you can see my mouse on the screen, in the chat? Yeah, okay, cool. So this September, so this is when medical school starts, right? That means that you submit your application a year before, and really you should be preparing about a year before that. So now the process, it kind of ends around May sort of time, because you have your offers, and then really you're either just doing exams, or if you have your exam results and have an offer, this summer is just preparing you for medical school. So really what you want to do is we orientate everything around kind of this sort of period. Now, the UCAT window, as you can see here, so it's early July to the end of September. Pretty much the same that the UCAS window is usually kind of around the 7th-ish of September. That changes by a couple of days here and there each year, but it always finishes on the 15th of October. The UCAT date, so the date that you can sit the exam, is usually kind of around the 8th-ish of July, and then it usually finishes on the 30th of September, pretty much, or 29th of September, sorry, most years. So it's about just shy of a 3-month window. So, somebody asked earlier, when do I sit it? Well, this is actually, it's quite a wide range and quite varied depending on what's going on in your life, right? So let me just go back so let's look at the UCAT timeline. So this year it will be, so the testing starts on the 10th of July, and then the last test date is the 29th, right? 28th this year. So like I say, it varies a couple of days year on year. So that's quite a big window. It's quite a long time. And, when do I do it? When do I start? The one thing that I will say is, think of the hottest concert tickets going, like, I don't know, if you're into Drake or whatever, imagine that their tickets go on sale. What would you do? You'd be on the website 10 minutes before, refreshing the page, getting ready for it to go live, so that you make sure that you get your place. I know it's weird to say this, but UCAT is ridiculously busy on the morning that it opens. So the booking opens at 6 a.m. on the 20th of June. Be there at 5:55 on the website, ready to do it. So the 16th of May is when you can set up your account. So do that, have that done. You don't have to do that on the 16th of May, but have it done prior to the 20th of June so that you can just go in and book it, because it's ridiculous how quickly all of those places get taken. If you're in a big city, if you are in a popular location, if you want a popular time, if you want a popular date, they go very, very quickly. And when I'm teaching my students, it's like, again, it's that Olympian training. What do Olympians do? They control everything. They control how well they sleep. They control how well they eat. They control everything down to like the clothes that they're wearing, and just literally like things in the room or little details on their pillows, everything they think about, right? So when I'm thinking about my students booking the UCAT, I'm like, when do you work well? What are you? Are you someone who performs better in exams at 10 a.m.? Are you someone who's better in the afternoon? Pick a date pick a time that's going to suit that suits you. And these are the details that make it a marginal, well, a reasonable difference in people's performance, and then that makes a big difference in whether they're successful or not with the med school application. So just bear these dates in mind. But really what I'm trying to say is 10th of July to the 29th of September is when you can sit the exam. So think about it in the broader context. We want to really get this done and taken care of and squared off so that we can focus on the other bits, because there's a lot going on in this application, right? So I'll talk about next sections of the UCAT, but just to round this off, the way that I would think about the date of sitting your UCAT is I would factor in three things. Firstly, you need adequate preparation time. Now, I'll talk about what that looks like. So, enough time to prepare, minimal impact on other things in life. And that could be anything from current exams that you've got. So, if you've got your AS levels or if you've got other exams, you don't want to be having to double up and doing UCAT prep at the same time as exam prep. So you want minimal encroachment and impact on those other things, especially if it's your A levels, for example, because probably the least negotiable thing of the whole med school application is your grades. If you don't have the A levels that are required, they won't let you in, and that's in very rare circumstances is that negotiable. And then the third thing is that you want to do it early enough to move on to the next stage, but also to have time for a plan B. Now, plan B could be anything from sitting the GAMSAT if you're a grad, sitting the BMAT if you're undergrad or grad, and various other things that we can do if the UCAT doesn't go to plan. So we need to think about those things, because when I'm looking at my students that I'm helping to get in, I'm looking at plan A, B, C, D, all the way probably to F, right? So yeah, these are things that we just need to factor in. Was there anything else I wanted to say about this? If you'd like yes, Yazdan, if you want the timeline, if you go to, I'll get the link actually, but if you go to my website, futuredoc.com, in fact, I'll do that for you now. Just bear with me 1 second. Does anyone have any questions while I'm doing this? Because I can field some questions. If you want to type in the chat, if you want to unmute and have a conversation, so I feel a bit less lonely up here. Also, free resources. You can get a copy of that timeline by just going to the website and putting it in. How long is the UCAT? We spoke about that at the start. It's 2 hours. 2 hours. I can go quickly back. Is the GAMSAT? The GAMSAT. There is one university that takes GAMSAT for dentistry. Oh, I think it's Aberdeen. Where did we say? Sorry, just to go back. 2 hours, and then here are the times, right? So the UCAT goes 21 minutes of verbal reasoning. You get a minute of rest in between. So 1 minute of rest before you start, 21 minutes, 1 minute rest, 31 minutes, 1 minute, and so on and so on. So on my YouTube channel, I think I was coming to the, can we see the deciles again? Yes, of course. the deciles. There you go. Okay, right. Let's move on. Talked about that. So each section of the UCAT, I'm not going to touch too much on this. Again, if you go on my YouTube channel, I have a playlist for every single section, and I tell you, you know, the postcard version of how to do well on this. So, you know, if you want to get just a broad idea, that's a good place to go. It's not going to give you the level of detail required to get a 3,000 plus score, but it's a good starting point. So verbal reasoning, again, like I say, this is well, let me read to you. This is what it says on the UCAT website. So you'll have 21 minutes. So someone said, can you go back to the timings? I'm going to go through each of these. So 21 minutes for the UCAT, for the verbal reasoning, sorry. So 30 seconds per question, 11 passages to read through, made up of roughly 200 to 300 words per passage. So you essentially get asked questions based on the text, and some will be true, false, can't tell. Some will be complete the sentence. Some will say which of these sentences is true, which of these sentences is false, and it will be essentially 11 rounds of a passage with 4 accompanying questions. So yeah, that's the kind of thing that you get with that. Decision making, you will have so that's 31 minutes. Now this is the logical component. This is problem solving. This is the kind of questions where they go to the shop and they give you a list of shop A loaf of bread is 71 pence. In shop B, it's 83 pence. The beans are X amount in shop A, Y amount in shop B, and they'll say, which shop can so and so afford to make this recipe with? Or you basically just have to use your ability to kind of use logic and problem solving to answer questions. Now, this is quite varied, this section. You have, typically they say 6 types of questions. So this is just maybe expanding on the 6, but Venn diagrams is a big part of it. Drawing conclusions, syllogisms, probability and statistics for the maths fans amongst us. So yeah, lots of stuff that is kind of all encompassing. Decision making is what they actually say, that it's like a combination of the verbal reasoning and the quantitative reasoning. So it's combining words and numbers together to kind of come up with problems to solve. The quantitative reasoning is all about maths. So again, 25 minutes here. These two, abstract and quantitative, are the ones that people start the worst off with, and then go on to either do the best in or have the biggest improvement in. Now, so this one, 25 minutes, 36 questions, and this is just like GCSE maths type stuff. But again, remember what the UCAT is. The UCAT is doing well in the UCAT is doing 2 things: going through with accuracy and speed. So basically being fast enough to complete it with a good level of accuracy. And like I say, if you can get 80% accurate throughout, you will absolutely smash this. It doesn't sound like a lot, but you will do really well by getting 80% throughout and completing the whole test. So, typical stuff you'd expect in maths: rates, percentages, averages, graphs, ratios, area and volume, conversions, trigonometry, the usual fun stuff that we all love. Can you get the slides after the talk, Bethany? Yeah, sure. Why not? Cool. Abstract reasoning. So see this more as those IQ test type things. So so when you see IQ shapes, then it's kind of like, what's next in the pattern, or what's the odd one out? Or they'll give you 2 sets of shapes, and they'll say, which one does this belong to? Now that is what abstract reasoning is. And again, I don't want to overwhelm you by going through each of these in turn, because it's best to take one at a time and really focus on them. So again, I have an entire plate for every one of these sections. So verbal reasoning, decision making, quantitative, abstract, and situational judgment. I have a whole playlist on that YouTube channel. I can pop the link in again just so that you can find it. It's just the Future Doc YouTube channel. And yeah, you can get you can get every, like I say, the postcard version of everything that you need on there. So finally, situational judgment is the kind of what would Jesus do sort of scenarios where you get put, you learn a number of principles that are based on the GMC guidance, actually, the GMC duties of a doctor. So a lot of it is around what you should do, professionalism, confidentiality, patient safety, all of these things that they want to know that you're going to have the right mentality to be a safe and effective doctor. Now, really, the SJT, it's very similar in that you get a passage or a situation, and you get 5 questions based on that. And really, they either ask you, how appropriate is this? And they'll suggest an action. They'll give you a scenario. So maybe you caught somebody stealing something at work, and then they'll say, how appropriate is this? And it'd be very appropriate, appropriate but not ideal, inappropriate but not terrible, and then very inappropriate. And you have to choose, like, is this a really good thing to, is this, given the scenario, is this the best way to do things? Is this a terrible idea that's going to make it worse? Is it somewhere in the middle? And that sort of thing. Then the same with importance. It's like, how in the context of this, how important is this? So maybe this a situation where patient safety is at risk, right? And it's like, how important is it that you so there'll be something like, how important is it that you go to the patient directly and tell them straight away, to basically, in reading between the lines, to get them out of harm's way. So obviously that would be very important. How important is it that you rearrange the filing system in that scenario? Obviously ridiculous and not very important at all. So, but it will be everything, all the shades of gray in between that. So the how people do well is their ability to split hairs on the situational judgment. And again, I have an entire playlist on YouTube for you guys to digest and work that out. Now, preparation. A lot of people want to know how to prepare, and I would recommend a 3-phase approach. Now, there are things that you have to bear in mind with the UCAT. Phase 3, so the UCAT, firstly, the UCAT exam is an assault on the senses. You're trying to go fast, you're trying to process stuff, it's pressured, there's a lot that you need to get through, and a reasonable amount riding on it. So it is intense, it's tiring, and it's almost kind of an it's your ability to kind of maintain a good sustained level of performance for 2 hours. So we hear people talk about UCAT burnout, and I'm going to talk you through how I would recommend preparing and where the UCAT burnout can occur, right? Because phase 1 is familiarization. This is basically, let me see if so we talked about the 3 here, but familiarization is just where you understand what the questions are, what the best techniques are. Remember, priorities are speed and accuracy. So what the fastest, most accurate, that combination of fast and accurate techniques are for answering the questions right. That is your first kind of getting to know the paper sort of pass, right? You can start whenever you want. You can, get to know everything, just kind of take it at your own pace, just understand what it's all about. The second phase is to start implementing it. So to start actually putting these techniques into practice. Now, this is where I would recommend just trying stuff untimed. And dare I say, people can actually make the UCAT quite fun, the preparation quite fun, because if you're just doing it untimed and for practice, you can kind of treat it like the same way that people might do a Sudoku before bed, or that sort of like brain teaser puzzles. And if you're taking the pressure off, you can just very slowly get to learn the techniques, get familiar with everything. A lot of it is pattern recognition. Just get used to doing the kind of questions. The same things do pop up time and time again. So just going through the questions is a really good way to just feel like you've really built the foundation. Stages 1 and 2, these two stages are just foundation building. The final bit is the intense bit. So here I would say, so I'll give you some resources for these, but these are the these are the bits that you can kind of do, like I say, at your own pace. Here, really, all we want to do is practice questions with untimed until we're getting about 80% correct. And then you add the timer. And what you're trying to do is decrease the time, so increase the pace and maintain that score. So it's a bit like what we in weight training, they talk about progressive overload. So you can do something at 20 kilos, then so you try going up to 22 kilos. It's hard at first. You wait until you feel good at 22 kilos and you're getting the same performance. Then you move up to 24 kilos. And this is the same with slowly increasing the time. Now, yeah, so that's the kind of way to lay the foundations. Now, for familiarization, like I say, I've given you some YouTube videos that you can look at. There's the online courses. I do an online course that's about 20 hours, and it just basically goes through every single type of question, every single type of technique, what to do for each, and the kind of proven best methods. And then for the people on our Future Doc program, we do what we call deep dives, where we actually get official talks. We get people externally come from UCAT to come and give talks as to what the best techniques are, how to be efficient, and also the kind of cherry on top stuff that's going to give people that 3,000 plus score. Then, like I say, implementations. Here's where we're doing question banks and just practicing. And then, for example, for my students, we'll do one-on-one technique checking lessons and, things to make sure people are approaching it in the right way. Then this is when you start doing mock tests and time practice. Now, this is the bit that can get intense. I wouldn't say you need to spend too long on these areas, but if you do, people are quite keen and they want to start now. And I say, as long as you're not burning yourself out and you're just doing it, as I say, for fun and treating it a bit like a brain teaser and getting familiar with everything, that's fine. This is the bit that if you do too much, you will eventually hit a point of diminishing, and then actually a point beyond that of reducing returns if you spend too much time on this. So, 3 to 4 weeks of intense prep towards the end is like the final sprint of getting you to peak at the right time. Remember what I said at the start, the UCAT is a performance. It's not a knowledge-based test. It's a skills-based test. And what we're trying to do is train people to perform at the time and to peak. I was saying about Olympian training. As an Olympian, you want to be at a stage where you're hitting your best performance, your personal best on game day. And that's what we're trying to do. Now, I talked about free resources. So this is the one to look out for as a kind of how to prepare plan. And from that, you've got all the playlists that will direct you to all the playlists for each section. But what I say, so that the analogy that I use for the preparation and avoiding burnout, it's like sprint training. When someone's training to sprint, what they do is they will do really short, intense bursts of sprinting. So like if you're a sprinter, what you'd probably do is like either a 20 or a 50 meter or maybe something in between sprint. And you do that for less than 10 seconds. I mean, for professionals, it's probably, less than 7 seconds. But they would do that and then they would take a few minutes rest. What they're not doing is just sprinting all day, every day. So they'll do maybe, 10 sprints with long rests in between. And then they will have not particularly long sessions, because what happens if you sprinted all day, every day, you would burn out very quickly. You'd probably injure yourself. And actually, like I say, you would hit that point of diminishing returns. So yeah, it's really important to preserve your kind of well-being while you're preparing for the UCAT. So it's important to to not be doing practice all day every day. So you can do it in sessions, and we'll talk to one of our students in a moment who has got a very good kind of way that she prepared. But you want to do maybe like the exam's 2 hours, so do a 2 hour session and then a break, and then another 2 hour session and do a break, so that you're used to kind of performing for 2 hours and having your brain ticking over for that time. So that then you can then rest after and recover and be ready to do a second round. So for our students, so obviously for future students, asked the question about the course. Yeah, of course you have access to that. And actually we're doing a mock test. I think we decided on the 16th of March. So it's really important. As I said earlier, you don't want to be shocked into understanding the reality of the test a few weeks before you're due to sit it. What you want to do is understand what's coming and feel the pace of it, the pressure of it, understand what I mean about the importance of time and accuracy. So we'll be doing a mock test in just over a month. For anyone who's on the program. So that'll be a good place to start. And if anyone does want some one-on-one help, we've got a few places open at the moment for the one-on-one coaching program. And like I say, it's not just about the UCAT. The UCAT is a big element of it, but it's about the whole application process. And now is a really, really good time to start thinking about the whole thing. And if you're serious about your application, we want to get started pretty soon. So we've just had a few, we're actually, as I said at the start, we're coming to the end of the people who submitted their application in September. We'll be coming to the end of the cycle soon. We're already getting people having really good offers, and I'm really chuffed because this year we've had I've lost count of how many people who've come to us for their 5th attempt, a lot of people for their 3rd attempt. So they've tried without us and then come to us for help. And some students have had 4 previous goes without getting a single offer, and then have had like 2 or 3 offers from us for them this time. Or like we've had a couple of students who've had 2 completely failed attempts and then had 4 offers for medical school. So we know that it's working and is really helping people achieve their goal of getting into medical school. So it's application only. In fact, I'll find the link to if you guys want to apply to join. So it's an application and then an interview to see if you're suitable. But like I say, we have a very good success rate with getting students in. So you're more than welcome to apply there. The cost, well, it's something we discuss on the call, because firstly, you need to get through the application process, and then we kind of talk you through exactly how it works. So it's part of a wider conversation. Okay, so that's what you will get to one day when you become a doctor. So just bear that in mind, that all of this is hard work, and it's the application process is tough, and there are times when you do feel like it makes you question whether you want to do it. But I can assure you that what am I now? I'm over 15 years from when I first, what am I? Yeah, over 15 years from when I first thought about applying to medicine and, going through all that process. And you do have low times, but the high times way, way outweigh any of those. And it is still one of the best things I have ever done, going to medical school. And I assure you that although it's hard, it is worth it. And this is why, having somebody to help you along the way will keep you on track. A lot of people, when it gets tough, and especially in the few days and weeks running up to their UCAT exam, that's the time when people feel the pressure the most. Because remember, I talked about kind of squaring off each element of the application, because if you have too much, if you don't prepare the stuff before the UCAT, then that spills over into your UCAT prep. Then your UCAT prep spills over into the application time when you're writing your personal statement, choosing universities and all that stuff. Maybe you're even doing some work experience in that summer. If you can be focused and disciplined and compartmentalize everything, you will make it as stress-free as possible. You can actually make the application process quite enjoyable. Arbab, I'm not going to talk about the clearing process just because there's a video again on my YouTube channel. I have got a video about that, but I'll maybe talk about that on another talk. So question, is your online course sufficient? I mean, the online course is very good. I would say, I don't have data. Well, I only have feedback from the comments of people saying that they did well after doing the course, but I do have data on people who join the program who get, our one-on-one support, because we're very closely monitoring them. And I can say that for sure that one, we have really good success with getting students in. So anyway, what the point I'm making here is that it's, it is tough at times, but there's that saying of the more you sweat in peacetime, the less you bleed in wartime. And what that is basically saying is the more you prepare, the easier ride you'll have. It doesn't guarantee anything, but it sure will give you a better chance of succeeding. So, as promised, we have a special guest, and I'm going to introduce you to her now. What did I say? So this is Daisy. So Daisy is an ex-FutureDoc student who is now working with us. Daisy, like I say, I'll let her explain her story, but she absolutely smashed the UCAT and got into probably one of, if not the most UCAT demanding universities out there. And she did really well. She was very methodical in her preparation, and she is a living example of, if you prepare properly and do it right, you can very much stack the odds in your favor for doing well in this exam. So without further ado, I shall hand over to Daisy.
Hi everyone, I'm Daisy. So I'm a first year medic at Newcastle University, and I got 3010 and band 2 in my UCAT. So I just thought I'd come and talk a little bit today about sort of how I did it in it as a whole. So sort of starting off, I just wanted to say I'm the first in my family to even go to university, let alone go to med school. So sorry, I got band 2, by the way. Yeah, I'm the first in my family to go to university, let alone go to med school. So I really had no idea what I was doing. I saw this exam, I saw the UCAT, and I thought, like, what is that? I've never seen anything like it before. It's the most bizarre sort of thing when you look at it, especially abstract reasoning. When I started, I despised abstract reasoning with a passion. Not my thing. Anyway, it ended up being my best one, pretty much purely down to practice and sort of technique, just like help that I got from FutureDoc. So I was part of the FutureDoc Elite course. So they provided like loads of things. I'm sure Ashley has already said loads of them. So I sort of started off by watching Dr. Ashley's videos. He's got probably like hundreds of videos now on the UCAT all piled up. So I went through them bit by bit. And along with that, as I do a section, so say I watch all the verbal reasoning, then I'd go to one of Dr. Ashley's deep dive sessions where they'd go through like verbal reasoning, then they'd go through mock questions, which I find really helps your technique. But sort of my sort of timeline on how I did it, I gave myself about 5 weeks. I know it's different for everybody. Some people feel like they can do it in 4 weeks, or some people feel like they might need 2 months. It depends for everybody. I sort of started off by doing like a baseline exam. So I went on the UCAT website and I sat one of their official ones. I think there's like 4 or 5. And I sat one of them just to kind of see what I was coming out with. Now, don't be alarmed when you get your results for that. They probably likely weren't too fantastic. I think I came out with 2,300 at the beginning. So I had quite a jump from 2,300 to 3,010. So, you know, it can be done. If you're coming out and you're getting things like 2,400, you're stuck at 2,500. That's where I was about 4 weeks before my exam. So don't panic too much. So when I sat that exam, and obviously I realized, okay, right, I think I'm going to need about 5 weeks time. That's what I gave myself. I started off by doing untimed questions just to kind of gauge like what it all is. Obviously, as Dr. Ashley said, it's something like it's like something you've never seen before. Even verbal reasoning, it's so wild. Like there's just so many words and you've got to read so much in such little time. The timings, you know, you've got to sort of get used to, but you don't want to jump into that. You want to kind of see what the questions are like. So I gave myself about 2 weeks for that. And then I decided that I wanted to move on to my timed questions quite quickly. I didn't want to sit on the untimed practice because in the end, I could be getting 100% untimed, but that's not the problem. When it comes down to the timings, that's where you kind of stress out and you start losing a lot of marks. So I moved on to timed. I used Medify. You can use, I mean, I'm sure there's loads of question banks out there if you don't want to pay for the Medify ones, but I got myself like, I think it's like a 4-week course that I just did. So it gave me access to all their questions. So I started off by doing their mini mocks and their question banks. And then when I felt like I'd sort of understood most of the sections ish, then I started moving on to my mocks. So I'd do maybe a full mock every other day at the 3-week mark maybe. But I'd also spend my time, obviously doing a mock is all important, but at the end of the day, if you do your mock and you don't learn from your mistakes, then it's not going to be a lot of help. So I'd always set out maybe an hour and a half reviewing all of the questions that I do in every single mock or every single question I do. You'd go over it and be like, where did I go wrong? Because otherwise you're never going to learn from it. So then when it got to like the 2-week build up, I took it up a notch. I'd do maybe a mock every single day because I knew that I was going to hit my peak soon and I didn't want to crash and burn at the last moment. So I thought, well, I'll do a mock a day. I'll review it and then that gives me the rest of my day to do whatever I want. And that was fine with me. When it got to say a few days before, maybe I would have done 2 mocks a day, but obviously you don't have to because at the end of the day, when you're in that UCAT, you're only required to do one exam. You don't have to sit and do 2. But for me, I found that if I could do 2 mocks a day and I still didn't feel like burnt out and I still wasn't tired, I definitely would have had the stamina to do 1 exam and call it a day. The day before my exam, I decided to not really do anything. Maybe did a few questions here and there, just so that I'd sort of in the mindset. I didn't want to panic myself too much. I didn't want to burn out. As Dr. Ashley said, it can happen quite easily, but you don't want that to happen. This was all by the recommendation of Future Doc. I remember Dr. Ashley, when he just said about told you to like enjoy the UCAT, I remember him telling me the exact same thing when I was sitting it, and he said try and treat it like you would do like a Sudoku or a crossword. I ended up doing exactly that, and in the end I rather enjoyed sitting and doing some questions. So for me it wasn't too challenging when I went into the exam because I ended up really liking abstract reasoning. Funny to say, but it was my favorite. And in the end, you know, Dr. Ashley will tell you these things. He'll say do a baseline test. He'll tell you what to do the few days before. That's what you get when you join the Future Doc course. You'll get that extra help. You're also given an individual tutor who'll teach you like once a month, depending on what course you're on, and might teach you once a month. I had a fantastic tutor, and I actually went to him and I said, look, I'm really struggling on abstract reasoning. And he went through with me abstract reasoning, and I saw my results rapidly improve after that. But also, obviously, anyone on the Future Doc team, you could email them and they pretty much reply. Someone will reply quite quickly with help. So I remember I was really struggling on decision making, so I just emailed my tutor and they could help me get through that quite quickly. I also went to Future Docs. They normally do a deep dive, as I said, or they'd do mock sessions. They were very useful as well. I also remember, as Dr. Ashley's already told you, they bring in like officials, so they brought in UCAT officials. That sort of gives you the extra edge that you might not get when you're trying to learn by yourself. It gives you that sort of push on how to just get that little bit higher, because you know all the little tips and tricks that they'll teach you on the course. But yeah, I think that's everything that I wanted to say.
Cool, thanks, Daisy. And yeah, I mean, as you, what do you think about the kind of whole UCAT in the wider context of the application? Because I think it's very easy to think that it's all about just that, but people do ignore the other stuff, don't they? And I think being well organized and having it, like I say, compartmentalized makes the rest of the application a lot easier as well.
Yeah, I think that, I mean, we can't deny that I think the UCAT's becoming more and more important. I think lots of places are bumping up their interview cut-off. I've noticed that recently. Like, I can't remember what Newcastle's was for my year. It was probably 2,800, 2,900. So it's, I mean, lots of places are wanting more. But I do think, obviously, at the end of the day, the score of a UCAT isn't what would make a good doctor. There are other factors that you've got to think about, like the interview. I'd say that's probably one of the most important. The UCAT's just to get you to the interview. They don't necessarily care about your UCAT. No one in med school is going to ask you, like, what do you get in your UCAT? Because it doesn't matter that much. It's your interviews that will tend to be more important, like your further reading and things that you do around that would make you a good doctor. So it's sort of like a start off, I suppose.
Yeah, absolutely. Yeah, that's what I was saying at the start, is that it's it's not the be all. It's kind of the thing that can close the. It won't. It's not going to make your application, but a bad score can kind of damage your application, or close down your application for sure. So, well, just out of, because I'm not caught up with you in a while, how are things going at Newcastle? How are you liking first year?
I love it. I mean, it's great. Their way of teaching, I think I love it. Not to absolutely promote Newcastle, but if you can come to Newcastle, it's one of the best. They do case-based learning here, so everything's based around like a patient. They'll bring them in, you get to talk to them, and then like you'll do the anatomy related to it, and then you do physiology and everything. I love it. Also, the city is great city.
Yeah,
Great
really
great
fun.
nightlife if that's what you like.
Yeah, great. So, well, let's take some questions. So we've got a couple in the chat. Feel free to, interact. You're more than welcome to unmute and speak and have a chat with either myself or Daisy, whoever you want to ask the question to. So, how many hours did you do a day from untimed up until you did 2 mocks a day?
Okay, so when I started on my timed, I was probably doing maybe a couple hours a day, but obviously then I'd add a review on, so maybe that would take an hour. Maybe 3 hours a day. That was on like a good day. If not, maybe I'd do an hour and a half, 2 hours for about a week. And then when it got to my 2-week mark, before I sort of ramped it up a little bit, I was probably doing a 2-hour mock every day and then an hour review. And maybe if I felt like it, I'd do a few questions in the evening, just a few time questions, just to sort of keep my brain active. When it got to 2 mocks a day, that was when I was probably doing a good 5 hours a day, 6 hours a day. But I wasn't doing that for long. I only did that for a few days because obviously I did not want to push myself too much and burn out.
And Daisy touched on a really good point, is the importance of reviewing questions. I think a lot of people think that they just need to do practice questions, and the review is equally as important, because you need to understand, because you're tinkering all the time with your technique, and you need to understand not only what's not working and what you've got wrong, because you'll learn a lot from getting questions wrong. You also need to understand what you're doing right and why you've got those questions right, and when I do it this way, does it work better? Do I tend to score more highly? And yeah, the people who do well are the people who've tried tens of like thousands, if not tens of thousands of practice questions. Right. So we've got section specific stuff. So how did you, so I think it might be better to direct you towards the YouTube channel for this, because like I say, we have a whole playlist on this sort of thing. It's difficult to explain the whole section in a nutshell. We dedicate whole, like Daisy was saying, we dedicate whole 2 to 3 hour sessions on or full official talks on a section alone. So check out the YouTube playlist on each of the sections, or Daisy actually made a video. It's like a 30-minute video of her talking through each section and what she did to do well. Daisy, did you get offers from any other universities? You got, how many did you get, 2 or 3 offers?
I got an offer from Manchester and I was waitlisted for Sheffield, but obviously I declined it because
Yeah. So
Newcastle.
potentially would have got, who knows, but maybe we've
Yeah.
got a third one there. Nice. Do you want to, how did you revise the SJT, or how did you have a method for abstract reasoning? I think the thing that you did for abstract reasoning was quite good, so maybe tell them about that.
Yeah. So it's also good that I'm saying this now, because it means you can start as early as possible. It's not one of those things that you leave to the last minute. So for abstract reasoning, I mean, I don't know if it will work for you, but it certainly worked for me. Any pattern that I found, I wrote it down. Even like, I think I came up with about 8 pieces of paper where I'd written down every single pattern I could find. Because in the end, you tend to find the UCAT a little bit cheeky. They recycle their patterns quite often. You can tend to find that even if it's something that you can't recognize, you can kind of see a pattern that they might have used before, but they've just changed the shape, or they've just changed the angle. And you can spot that if you write them down. So that was my main method. Obviously, you can use, like, when I first started out, I also use like a mnemonic. So I know Dr. Ashley used Spartan IBS, which is like shape, pattern, I can't remember angles, I can't remember the rest of them. But if you write them down on the side of the page when you're practicing, and if you get really stuck, you can look down and think, oh, okay, what have I not thought about? Oh, the angles, maybe it's an angle thing. And that also really helped me. When you get more like used to it, because obviously one of the biggest things about abstract reasoning is just practice. It's one of those ones where you just got to do loads of questions. You don't necessarily have to rely on Spartan IBS or any mnemonic that you choose to use, but it is really good for starting out. So yeah, the SJT I used to start off with the SJT, because it's a funny section. It's always about what you would do, not what you should do, not what you would do. So in a situation, what you should do obviously isn't necessarily what you would do in real life, but you just have to think about it in that way. So I started off by reading the it's called the GMC, like good medical
guidance.
So I use that, and that really helps because it pretty much almost gives you the answers half the time. So if you just follow that, the likelihood is that you're going to be right, because it will tell you what you should be doing as a doctor or a junior doctor. That was my main thing for SJT.
Fantastic. Yeah, good. And yeah, like I say, playlists, like to go through all of that. Cool. Does anyone have any more questions? Coming up to an hour and a half, so we can probably wrap it up there. Again, if you want to put your hand up. Oh, there you go.
Sorry, I just unmuted.
It's okay. Who do we have there?
Yeah, I'm Nad.
Nad.
Yeah.
Nice to meet you, Nad. Do you have a question?
Yeah, I had a question about the.
Oh, we've lost you.
Program. So, how
Oh, sorry.
how is that managed, especially during UCAT? The one-to-one program
Yeah,
that you
sure.
have.
Go ahead.
Yeah. So, I just wanted to know how much of a time commitment that is. Especially during like the busy kind of phase 3 where you do UCAT, your application, going into interviews.
Absolutely. Well, so bear in mind, Nad, that everybody who is on our program is either in their final year, year 12/year 13 of school, or working full time in a job, or they are in the final year of university, or second/final year of university. So the idea is that it's kind of scheduled alongside all of that. So it's a very manageable time commitment. We've been doing it for years now. So it's about getting the balance right between enough work to give you the score that you need, but not too much that you're overwhelmed. And I always say to my students, and I was touching on this earlier, is that you need to prioritize your school exams. It's non-negotiable. It's the most non-negotiable part of the application, probably. That so we need to make sure that we're prioritizing people doing well in those. Really, as a priority, or if not equal priority to the med school application. So in time wise, it's very manageable. All the one-on-one stuff is, you arrange at your own leisure. You work it around your schedule. So it's very flexible in that sense. And, we have live sessions, but they're also recorded if people can't make it for whatever reason, and they're there to review again if you want to go over any of the bits. So it's very workable. Daisy, how did you feel that because obviously, you were doing like everybody, you're doing it at a very critical time of your education. How did you find managing it?
I think that Future Doc works around your schedule. So it's not too much of a time commitment. I think they understand that this is a very, very busy time for us when you're sitting the UCAT. So they're not going to take up unnecessary time. Everything that they do is essential learning. So maybe you'd have to take out an hour a week to do a deep dive session on verbal reasoning or whatever section, or you take out an hour because you have a session with your tutor. But at the end of the day, it's stuff that you're going to need. So it's not anything unnecessary.
Yeah. Does that help, Nad?
Yeah, thank you. I mean, I was also considering if it's possible to join the course, around UCAT time. So the main, covering UCAT and then interviews
So,
and
so, remember what did I say? There's kind of been a theme throughout the talk that don't think that it's just about doing well in the UCAT. I would try and avoid thinking, all right, all I need to do is just get through the UCAT, because what I'm seeing, and this last year more than ever, and the year before as well, I'm seeing a lot of people who come to us for help because they've messed up the application. Well, not messed up the application, but they haven't been successful with the application, and they've done well on the they've made the mistake of thinking that it's just about the UCAT. So they've done well on that, but then they've got to interview, but they've not got beyond interview. And like I say to my students, we're preparing for interview now. And that means we're laying the foundations, getting the experience, gaining the knowledge, doing everything. And it's about building a solid application, not about cheat coding the elements. We're not trying to hack it. We're trying to teach ourselves to be the real deal. We're trying to be just the best possible applicant we can be, and then that gives us not only peace of mind that we've got a good chance of getting in, but then lets us think about going to some of the more competitive universities. So yeah, like I say, our UCAT training kind of officially starts in the next few weeks when we're doing that mock test. But there's preparation to be done for other elements of the application prior to that. Okay, so let me just go through some chat questions. So let's see. Is your video on the Future Doc course on the YouTube channel? Yeah, it's called 5 things. 5 things you. I'll find the link for it. But yeah, I'll get that. Any recommendations on how to structure revision if you're going abroad during the summer holiday? So it really depends. When you say going abroad, it depends if you're going on a beach holiday and you're not going to have access to a computer, or if you can do some revision. I would say this is where, that I was saying those 3 elements of when to sit your exam. If you can do it before you go away, then great, and that's feasible. You can kind of do a straddled approach where you do the kind of phases 1 and 2 before you go away, come back, maybe refresh on phases 1 and 2, and then move on to phase 3 when you get back. If you're away and you can do a couple of hours every day on a good computer with good internet access, and you can do it at the normal pace, then do that. very difficult to say. Like, these sorts of questions are very difficult to answer because it's very personal to you. So that's why, with my students, like when Daisy joined, the very first thing we did was we sat down and had a strategy session, and we dissect everything about your individual application, your circumstances. Are you going away in the summer? And we set a plan that's specific to you. So yeah, this is the kind of thing, we'd sit down and spend, well, on this alone, we'd probably spend 20 to 30 minutes, and the whole thing we'd spend hours, working out exactly what we're going to plan for the next 15 months. Any last minute tips on the day? I would say any last minute tips for on the day, just look at that video that I made. It's called UCAT in exam tactics, what to do on the day. I'll find that link as well. Can gap year students do the course? Yes, they can. Did you apply as a grad or as an undergrad student? Daisy was an undergrad. We're actually getting a bit of a Newcastle crew building up. There's also Josh, who was on the program last year. Josh did really. You remember what Josh got on the UCAT?
I seem to think he got over 3,100.
Yeah, I think he got
even be 3,200. I think he was.
Yeah.
Insane.
So Josh is a grad that applied to Newcastle, and the Newcastle grad program last year had like 42 applicants to one place, and Josh managed to get in. So so he's a grad at Newcastle. I saw him recently, and he's in the exam cave at the moment. So hopefully he comes out of it alive.
There's about 20 people on that course, and they do 2 years in 1 year. So where I find it obviously quite stressful. I'm still on year 1, case 8. He's on something like case 22, and he's finished year 2 already.
He's lapping you.
Wow, like that's absolutely, it's crazy.
Yeah, no, I had a similar thing for dentistry. It's it's fun. It's character building, as they say. So let me see. Any more questions? How do you learn from wrongly answered questions? So it's a good one for you, Daisy. How did you learn from incorrectly answered questions during practice?
So this tends to it depends on the section. So for something like quantitative reasoning, if I kept getting questions wrong on, say, volume questions, I'd keep getting it wrong. I'd go away. I'd recognize that that's where I'm falling down on my marks. I'd go and watch a video. So Future Doc will probably have a video on everything in quantitative reasoning, or everything in every section. So I'd watch a video on that, and maybe I'd go away and I'd look on maybe the UCAT website, or Medify might have videos, and then I'd just do practice questions on a specific thing that I'm struggling with. So if I struggle with volumes, I'll filter out and I'll do maybe 50 questions on just volumes to try and improve. For things like SJT, that would be like reading up where I've gone wrong. Verbal reasoning, it's just about taking the time to really read through and think, oh, hang on, so why did I actually get that wrong? Did I read the question wrong, or am I not inferring something am I not seeing something that there is in the text, or something like that? Yeah.
Cool. Right, so I'm just kind of working through some of these questions. So would you say it's too late to join the course? Not at all. No, this is about the right time to join. I would say. You don't want to leave it much later though, because then you are starting to get a bit late. Interview online course once purchased. How many months access do you get? So 12 months for that. Will there be any more conferences nearer the time? We might put on a few more chats. I'll see how it goes. During actual UCAT, I heard you got given a whiteboard. Do you only get one you can rub out, or did they give you another whiteboard once it's full? Oh, it's a erasable marker, so you get a little sponge with it as well, and you can just rub it out and keep using it. Any chance to speak to grads on the elite program? Yeah, absolutely. We have grad specific tour. Any quirks in the application? So if you're an international, if you're a grad, if you're what else do we have? Oxbridge. If you have you know, it's very individual, so we just cater specifically to everybody. So whatever it is, we'll have something specific to that. Is there any chance to speak to Chris? I asked that one. Is it too late to start the course? So like I said, no, it's not too late. Also, can you bring your own whiteboard? No, you can't bring your own whiteboard. No. I'm not sure why you want to do that, but yeah, that's they just give you just turn up with yourself and some ID. So yeah, so like I say, the deadline per se is that we're starting in the next couple of weeks. So if people are thinking, let me just give you the link. If people are thinking or applying to the course, we've got a few spaces available because, like I said before, you know, there's people that have graduated because they've now got offers and got into med school. We've had a few places free up. I think it's like about, I don't know, in the region of like between 5 and 10. So I'll send you guys an email with all the videos that we talked about and maybe some links if you want to apply, and I'll give you an update on how many places we've got left. But so when is the deadline? You mentioned Daisy, half an hour. Yeah, so Michelle's asking about how to access Daisy's video. So again, if you go to the YouTube channel, you can find it on there. It'll be how I scored 3,000 plus in the UCAT or something like that. So yeah, lots of content for you on there. Okay, cool. I think that brings us to a nice natural point to come to a close. But yeah, I just kind of want to end on the note of, remember that thing I said, the more you sweat in peacetime, the less you bleed in wartime. And that's just like a very, well, ancient way or poetic way of saying the more work you put into this, you know, obviously within the context of the UCAT, we want to preserve ourselves, but the more intelligently and in a more structured way that you can prepare for this, the easier you will make this whole ride and the less stressful summer will be. And ultimately, as Daisy said, the higher your chances of enjoying it, and that is just going to increase your chances of success. So, you know, you can do this the hard way, or you can do this the not so hard way. And yeah, if you check out like I say, check out the videos on the YouTube channel, you can get some guidance on how to do that. Obviously, if you want our help, you're more than welcome to apply to be on the program. But yeah, so thank you for coming today. Like I say, I shall send you an email probably in the next 20 minutes or so, just to update you on all the stuff that we talked about. But it was lovely to have you all today. Thank you so much for coming. Thanks for your time. You know, it's not the nicest weekend day, but still it's a weekend, so I appreciate that. And please give a massive thank you to Daisy for taking time out of her busy uni schedule. And yes, I wish you the best of luck for the exams coming up. I imagine fairly soon. How long until you've got exams, Daisy?
They're not until May. I think my first one's my OSCE in May.
Great. Oh, OSCE's in first year. Interesting.
Yeah, they've started them now.
Nice. Okay, great. Well,
not sure why.
well, best of luck with them, and thank you for coming today. But thanks, guys. Best of luck with everything. You know where to find us if you need anything. So take care, and I shall see you all soon.